Hi, I'm Dr. Andrea Polard and I am the clinical psychologist for paradigm treatment. Our assessment in paradigm treatment is pretty excessive. We want to be thorough. It's very important for us to catch things that might have fallen through the cracks in other places. So we are doing, of course, assessments for depression and suicidal ideation. Specifically, we're going to do the ADOS, which is an autistic observation schedule. We are doing neurological testing and finding out if there may be some learning differences, but also cognitive strength and weaknesses. So we are using the Wechsler intelligence test for both youth and adults. And we are doing very extensively a personality test that has over 500 questions. It's called the MMPI. That is the Minnesota Multiphasic Personality Inventory. I was also trained in the facial action coding system developed by Ekman and Friesen, which I can look at subtle changes in the nonverbal behavior, which can be very telling as well. So why is this all important? Especially with our personality test, which we do always, and not just by request. We're catching someone's response style and their characteristics and how it interweaves with the symptomatology. So this can be very, very telling, very informative of whether a person, for example, is introverted or slightly immature, honest, open, guarded, tends to be more depressed or more anxious, type A, or has some maybe schizoid personality traits, or tends to be disregarding all rules, and how the sleep is and how the sleep pattern is, and so on and so on. It's very extensive. And then once I have a clearer picture with this assessment tool, I have a very cooperative assessment interview with each client and find out what is really true and what is not, because sometimes the test or the assessment actually suggests something that isn't really applicable to the client, and sometimes something needs to be made very personal. And we're coming up with an agreement of what it is that the client actually suffers from, and I write up an assessment for each client and bring it to our team. There I introduce the team to what I have been finding, and we are discussing each client based on that, and we are with the help of the psychiatrist also finding the right diagnosis and the treatment plan. So this works really well. Because we are a very individualized treatment program, not everyone gets the same assessment. So this really depends on the client. We give the client what we think is most needed and most revealing and most helpful.